Hi, I'm Dr. John Neustadt, president and founder of Nutritional Biochemistry Incorporated, NBI, and I'm back again this week on a Facebook Live, and in fact, back again from just a couple of minutes ago because, in fact, I was recording this and I don't know what happened. I lost internet connection. So we're going to try this again. I hope you find it helpful in discovering what you can do to speak with your healthcare provider about symptoms you're having, perhaps fatigue, dizziness, restless leg syndrome, thinning hair, brain fog, because an oftentimes overlooked underlying cause of those symptoms and more is iron deficiency. And unfortunately, iron deficiency frequently gets missed. It gets missed because most doctors, when they're doing a screen, or most healthcare providers, when they're doing a screen in the clinic, will run a CBC test. CBC stands for complete blood count, and in that test, we test for red blood cells and indicators of red blood cell health. Red blood cells carry oxygen through the body, and iron is required for that. When you don't have enough iron to produce the oxygen-carrying proteins in the blood, called hemoglobin, those indicators on the CBC test can decline. The problem is, or the challenge for both patients and clinicians, is that the life of a red blood cell is about 3 months. But somebody can become deficient in iron, can have low iron long before it actually shows up on a complete blood count. You can be experiencing symptoms of low iron, and it's not picked up on a complete blood count. The most sensitive indicator for iron status is a serum ferritin test. Ferritin is the storage form of iron in the body. 80% of iron is stored as ferritin. Iron, like most nutrients, is used for many different things in the body. For iron, in addition to carrying oxygen in the body, iron's used for producing hormones such as dopamine. It's used by mitochondria for energy production. And when you're low in ferritin, you can start to feel fatigued. You can start to feel dizziness. There are symptoms associated or caused by iron deficiency, and there's a long list. The challenge, though, is that the reference range for ferritin, when it's run as a test, and it is the most sensitive indicator of iron status, when it's run as a test, that reference range is so big as to be clinically irrelevant. The low end of the reference range of normal, considered normal, can be as low as 12, all the way up to over 200. Now, what does normal mean anyway? Well, normal means that laboratories just take a sample of so many patients, 1,000, 100 different blood samples, and they apply some statistics for it. And they say, okay, 95% of the lab tests that were run fit into this range, and we're going to call that normal. 2.5% are going to be above that, abnormally high, and 2.5% are going to be abnormally low below that. And with ferritin, what we see is a range of 12 to all the way up over 200. But the studies have shown that if somebody has a ferritin of 50 or lower, they can actually be symptomatic for low iron and can be experiencing the effects of low iron, such as fatigue. And when they are replenished with iron, when they're given iron as a dietary supplement, that their fatigue, in one study, their fatigue improved by nearly 50%. The reference range for ferritin also changes depending on your age. As you get older, or if you have an inflammatory condition, people should be considered low in ferritin if their number is below 100. And that's because ferritin can be elevated in cases of inflammation. And as we get older, there are greater risks, and a higher percentage of the population has inflammatory conditions, such as arthritis, for example, or irritable bowel disease, Crohn's, ulcerative colitis. Those can cause inflammation as well. And so you want to really be careful when you go in and you're feeling any of these symptoms: fatigue, dizziness, confusion, restless leg syndrome, to ask for a serum ferritin test and really make sure it's interpreted properly. Now, people can consume iron as in the diet. It is in the diet. It's in steak and legumes such as lentils is an excellent source. There are other good sources, but if you're low and deficient in iron, the replenishment amount that people need to actually increase back up into the healthy range is going to be about 2 to 3 milligrams per kilogram per day of iron. So if you take your body weight in pounds and you divide it by 2, and that's about the number of milligrams. But the challenge is the products that have been out there in the market historically are of the form of iron that really just tears up your gut. It causes constipation or abdominal cramping, and those are in the forms of an iron gluconate or iron sulfate, and those forms that cause those side effects really end up making people want to stop taking it. But there are forms of iron as dietary supplements that can be up to 75% absorbable, that are natural and totally easy on the gut, and that's what you want to seek out. And that's actually what I created for my patients, because they were suffering with iron deficiency and coming in with these other supplements and not being able to take enough to replenish themselves. You're going to need more iron in certain phases in your life, especially if you're a woman. Menstruating women are at high risk for iron deficiency because they lose blood in their periods every day. Pregnancy, that increases the requirement for iron. You've got a baby growing, inside, and that baby, that fetus needs more nutrients, and it increases your requirement for iron as well. In terms of as we get older, anything, you've got to watch out, because once your period is stopped, if you're a woman, or if you're a man and you end up having iron deficiency, you've got to seek out the underlying cause. It could be a slow gastrointestinal bleed, losing blood. And so you want to investigate that with your healthcare provider if you're in that age range. So I hope this has been helpful. This is by no means all the information on this subject or the list of symptoms and what you can do about it. Foods you can take, dietary supplements, what to look for, how to evaluate it, questions and topics that you can discuss with your healthcare provider and start looking at for yourself. Those are online at NBIHealth.com, where I've created products to help people, but I've created also a ton of free information and free resources to help you become a savvy healthcare consumer, to help you improve your health. And there is a new article on there about iron, and there's a blog on there that has a list of foods that are rich in iron and what you can do, both in terms of testing, conversations with your healthcare provider, and how you can be proactive in your health. So I hope you have a fantastic day and a great week, and I will see you back here next week. Bye.